Hi everyone, I'm Dr. Esha Chainani. I'm an obstetrician, gynecologist, and a laparoscopic surgeon as well. I practice in Mumbai, India. So I've done my MBBS, my MS in obstetrics and gynecology, and also my FMAS, which is a fellowship in laparoscopic surgery as well. I practice in Mumbai, so I'm at Khar West at Mahavir Hospital and at Shivaji Park at Thakur Hospital. I specialize in pregnancy, infertility, high risk pregnancies, also things like PCOS, menopause, fibroids, and I operate on fibroids, hysterectomies, and gynec cancers as well. Okay, so we've got a question here. I experienced grayish discharge at a time during pregnancy, just for a day or two. Is it a sign of infection? Okay, so when you're pregnant, there's a lot of hormonal ups and downs that do happen. So because of this, sometimes you may have a little more than normal white discharge, which is especially more in your first trimester because of the hormonal changes that are happening. Now, this kind of white discharge should be either colorless or slightly white, sticky, and have no smell or no, and it shouldn't be yellow or greenish. So if it is like that, and if it only happens a little bit, that's absolutely normal. However, if you have itching, if you have burning, if you have reddish or yellowish or greenish discharge, if it is a lot of discharge, if there's a lot of smell, then it could be an infection and you should see your gynecologist. How can I prevent urine infection during pregnancy beside following a good hygiene? Okay, so when you're pregnant, you have a lower immunity than normal. Okay, and this is because, of course, you're growing a baby inside of you. So, because you have a lower immunity, you also have a higher than normal risk of developing a UTI. First of all, women get more UTIs than men in the first place because your bladder is very close to the outlet, which is your urethra, which is very short compared to much longer in men. So that's why bacteria can enter far more quicker and you can get infections. So now, how do you prevent the urine infection? One is drink plenty of water. Two is do not wait and hold in your pee when you go. So the more you keep it in, the more higher chances there are of bacterial infections to develop in that area. The third is keep the area clean. Change your underwears. Wear loose underwears, ideally cotton, and change it twice a day. What are the danger signs of UTI that I should worry about during pregnancy? So as we said, if you're pregnant, you're far more likely to have a UTI than if you're not pregnant. So one, that's very important. Also, when you have a UTI, what is really important to know is when you're pregnant and you have a UTI, it can actually, because of the low immunity, spread into higher into your kidney, into your pelvis, and because you're pregnant, you may not realize any of the symptoms because a lot of them mirror pregnancy symptoms as well. So you should do a urine routine examination every trimester and also look for these danger signs. So things like burning while you pee, peeing a lot suddenly after you pee, if you don't feel like it is complete and you get up and then go back again. Sometimes it'll hurt when you're peeing. Sometimes you may have fever as well. These are the kind of things that you should keep in mind and they're danger symptoms. So next question. I experience recurrent fungal infection. What could be the reason and how can I manage this? Okay, so again, when you're pregnant, because of the low immunity, you can have recurrent fungal infections. So this is also, and when I talk about fungal infection, I talk about the vaginal or the vulval fungal infection in your groin region. Also, if you're diabetic, especially if you're diabetic during pregnancy, called gestational diabetes, that's when you do have a higher than normal chance of developing these fungal infections. Now, how do you know it's a fungal infection? First of all, you will have a lot more discharge vaginally. It will be curdy white, so it will be like dahi kind of white. It'll be smelling. You will always, your underwear will get wet. You'll just feel uncomfortable. You can also have a lot of itching. It might also burn while you pee because of all the itching. There may be a lot of redness in that area as well. So that is something that you can look at for a fungal infection. That's when you know it's a fungal infection. Now, recurrent fungal infections are unfortunately common if, one, you do not treat the fungal infection properly. Now, a fungal infection, especially vaginally, needs to be treated with antifungal agents. These are not things that you can just buy at your chemist or pharmacy, or these are not things that can magically just go away on their own. They will be there in that area and they will fester in that area. So, one is, if you don't get your fungal infection properly treated and actually cured, it might go down a bit, but again, it'll come up and again, it'll be very, what do you call it? It'll be very irritating and you'll keep having a recurrent infection because you have not treated that infection properly. Second cause of recurrent fungal infections is your sugar levels are very high. So this could be because of the diet you're on. This could be that you're diabetic, all of these things. So it's very common in diabetics to have recurrent fungal infections. If you manage your diabetes, it should reduce further. Then another recurrent cause is because you may not have taken treatment, and your partner may have gotten the fungal infection as well. Then you take treatment, but your partner gives it back to you. Then you give it back to your partner. Then your partner gives it back to you. So there is like this huge cycle of fungal infections that happen. So when you are treated for a fungal infection, make sure that your partner is treated as well. So that can prevent these recurrent infections. I think that's everything about fungal infections. What home care should I follow while managing a fungal infection during pregnancy? So as we talked about, pregnancy causes a lot of lower immunity. There's a baby growing inside of you. A lot of times it's pushing on your kidneys. That's also why you may have increased UTIs, things like that. But even fungal infections. So I'm going to do both, how to prevent a UTI and how to prevent a fungal infection, especially when you're pregnant. So for a fungal infection, one thing is very important is to maintain vaginal hygiene. So keep it clean, wash it with only water. You don't even need soap, especially inside. So the vulva is basically outside and the vagina is the tube that is inside. So you don't need to wash with soap inside your vagina. You can wash with soap outside on the vulva. Even then, you don't need to wash it with soap. Just water is absolutely fine. Your vagina has enough, it's self-cleaning. It cleans by itself. You don't need to put soap there. It will change the entire pH of your vagina in that sense. So don't use any kind of hygiene products. Don't use soap. You do not need it at all. Okay, so that's one thing. The other thing is to prevent fungal infections. Wear cotton underwear, wear loose underwear. If you have a lot of discharge normally, or you have very long days, you can wear a panty liner so that your underwear doesn't get wet and then lead to more infections, things like that. Manage your diet, manage your sugar levels, especially, and keep the area clean. No douching. I think a lot of people don't even know what douching is, but they do it unintentionally. Douching is when you spray water up your vagina to clean it. When you do that, first of all, if you have an infection outside, it can spread inside. The second thing is, again, this disturbs the pH of your vaginal region. So you do not need to do that. You do not need these fancy products. Also, you don't need any kind of perfumed products, because those can cause allergies there and then lead to, again, fungal infections. So we've talked about fungal infection, home care. Also, what's very important to know is, when you do think that it is an infection, please see your gynecologist, because it's very important to not self-treat this, because it'll just get worse and you will keep having this, and it can also spread into your pelvis as well, which we do not want happening. So please see your gynecologist. The treatment is not very difficult, but we do need to see you, and we do need to see and check out what kind of discharge it is, what kind of infection it is, and then give you the treatment for the same. If you do not have a gynecologist, you can always come and see me. I'm at Shivaji Park and Khar West. So that's home care for fungal infections. Now we talk about home care for UTIs. We talked about how you would know it's a UTI. So burning, pain while you pee, lots of peeing, constantly peeing. Also, you pee a little, think you're done, get up. Again, you come back in 2 minutes thinking you need to pee again. And while you pee, it's painful, sometimes maybe fever as well. Now, how to prevent this, because it is very common in pregnancy, especially. Now, one thing is, drink lots of water. Drink at least 2 liters of water a day. We always think we've had enough water, but only when you count it can you actually see how much you're drinking. So get a liter bottle and fill that up and drink 2 bottles of that at the minimum every day. Just being hydrated will help prevent UTIs in the first place. The second is, don't hold in your pee. So if you want to pee and you feel like peeing and you think the bathroom is disgusting in the place you are, it does not matter. Holding in your pee will cause far more infections than a dirty bathroom. That I can promise you. And there's research done on this as well. So please don't hold in your pee. Pee whenever you can, especially because when you drink a lot of water, you need to pee. So don't hold it in. That can also cause infections. The third thing is, wipe your pee or front to back, or when you go to the bathroom to poop, don't wipe back to front, go front to back. Okay, that's very important, because the fecal matter can go into your vulval and vaginal region if you wipe back to front. So please don't do that. After you pee, wait on the pot for about 2 minutes till all the droplets have gone away, because those droplets shouldn't go on your underwear and then lead to an infection again. So wait there, sit till you completely finish peeing, even all the drops go out. After that, if you want, you can wipe with a tissue, or you can wash, or you can just wait for 2 minutes till all of the droplets go away. Then you stand and pull up your underwear. Even things like that will be very useful, especially in your third trimester of pregnancy, where you need to keep going to the loo. Again, your chances of getting a UTI are very high. So please be careful with this. If you're having sex, urinate before and after sex, but definitely after sex, and clean up that area. You just need to clean it with water, but do that. Avoid scented products on your vagina, no matter what they are or how pH balanced they are. You do not need them. Water is good enough. Also, if you have a lot of antibiotics, you may have a little higher than normal chance of developing UTIs. So be sure to have a lot of probiotics. So for example, dahi, kimchi, things like that. But dahi is a very good probiotic that you can have. Now, if you do have a UTI, whatever you do, home care is not going to cut it. These tips are just to prevent fungal infections and to prevent UTIs. If you do have a UTI, please see your doctor. Please get it treated. You will need antibiotics to treat it. A lot of times, you may need to do a urine culture to actually see which bacteria it is that is causing this. And then we give you antibiotics just for that bacteria. Please go to your doctor, take the antibiotics, take the entire course of antibiotics, and you should be good. Will a UTI during pregnancy reduce my chance of a normal delivery? No, it will not. A UTI is an infection. First of all, your urine tube and your baby birth tube, which is your vagina, are very different, though they are in similar places and next to each other. But having a urinary infection will not reduce your chances of a vaginal delivery. However, you need to treat the urinary infection because it is very important so it does not spread to your kidneys and the rest of your body. So please, it is not a very simple disease just because it's a UTI. When you are pregnant and you have a UTI, it can evolve into a very big problem. So please see your doctor, please get it treated. Don't just say it's a burning and I don't need to do anything about it, or naturally I will manage it. You sometimes may not be able to. So please see your doctor. I think that was the last question. What do we take away from this? I think very important. One is how to prevent it, how to prevent UTIs, how to prevent vaginal infections. This is something that we've talked about. A lot has to do with hygiene, and a lot has to do with keeping the area clean, again, only with water. The other thing is to, if anything is wrong, especially when you're pregnant, please see your gynecologist. If you don't have a gynecologist, you can see me if you're in Mumbai. I think that's absolutely fine. But yep, I think that's about it. Take care and be safe.